You're live.
There you go.
You're good to go, Jane.
Okay. Exactly 6:30. Okay, we'll go ahead and officially call the meeting to order. It looks like we have a guest, Claire from Beaver Creek. Do you want to tell us a little bit about you or what?
I am a nurse practitioner student at University of Cincinnati. So for my public health class, they want us to attend a local state or some kind of public health meeting. And then we have to do a video discussion about it.
Okay.
That is why I'm here.
If you have any questions afterwards, I'll be here and but we're glad to have you. Okay, we'll move on to, we need a motion and a second for the adoption of the consent agendas and the meetings from the meeting minutes from last month. Are there any changes or additions to either of those? Hearing none, I'll take a motion and a second.
So moved.
Okay.
Second.
All right. Okay. All in favor, say aye.
Aye.
Opposed?
Aye.
Okay. Adopted those two. Next we have a presentation tonight about the 2025 levy by Noah.
I guess since we've got people online, are you able to announce who's online? Because I don't know.
Oh, okay.
I'll look at
Yeah.
view it.
Yeah, so we have Melissa, Shadrick, and
Cheryl.
and Jennifer.
Okay. And Angie was.
Yeah, she's
Yeah,
Yeah, thank you.
thank you. I'll have to remember to do that each meeting. Okay. Noah?
Sure. All right, so tonight we're talking about a topic that's obviously pretty hot right now. It's talking about levies and property tax. So there's a lot of legislation that's been floating around. It's particularly relevant for us this year because we are to be on the ballot in November. So tonight's presentation is going to cover a little bit about how the levy works here, how levies work in general, what's going on legislatively, and then what the process is for us moving forward to be on the ballot in November, and then answer any questions you may have. So when we talk about levies and we talk about funding sources, reverb. Welcome in. So there's two types of funding sources we primarily get, and we have inside millage and outside millage. Outside millage is anything outside the law. That's why it's called outside millage, and that's something that requires a vote. So it requires voter approval in order to go into effect. So what we use is a mill. So we use millage to define what the value is going to be. And what that equates to is about $1 for every $1,000 of assessed value. So if you think about trying to apply that to the value of your house, then you can determine based on the mill rate how much you're pretty much paying in property tax for whatever a levy is running their millage rate at. So in Ohio, it's not like you get taxed on the full value of your property. Right now, Ohio taxes on 35% of the market value. So it's not the full 100% of whatever your assessed value is. It's 35% of that. So you can run it for 10 years or less. So 10 years is the max you can run a levy. And right now, and I say right now because there's legislation out there that can revamp some of this. Right now, there are 5 different kind of types of levies that you can run. You can do a renewal with an increase or a decrease, a replacement, and then a replacement with an increase or a decrease. And that is right now, but that could change, and I'll get into that in a little bit. So our current levy. So our current levy runs for 5 years. We were on the ballot last time in 2020. So next year is the last year that levy will collect. So 2026 will be the last collection year of the levy that was passed in 2020. So it's a 5-year levy, so it'll expire in this year. So we have a 0.8 mil levy currently. And again, like I said, the last time we ran it in 2020, it was for 5 years, and it was a renewal. So it was renewal rate, so it was no new millage, or no change. So, right now it equates to about $28 per $100,000 of appraised value, is what it costs you for public health service. And right now it accounts for about 48% of our estimated revenue. So it's about $3.6 million that the property taxes bring in for us. So to put that in perspective, again, it's about 50% of the money that we bring in that helps support all of our services is dependent upon those property tax dollars. So it's pretty important and pretty vital to our operations. And a lot of health departments in Ohio operate, as well as a lot of other public service, run off property tax dollars, run off levies. So segueing that into this, well, the next slide is legislation, sorry. So the steps to the levy and what we'll have to do next are these 4 steps. So in July, we will have to meet in person per the virtual meeting policy. If you weren't already planning on attending in person, you'll need to attend in person in July because there are 3 instances in which you need to meet, and one of them is to vote on tax issues. So in July, we will pass a resolution of necessity, which says the Board of Health is stating that we need these funds to help operate public health service in Greene County. So we are going to certify that we need to be on the ballot again and run a levy. So that is the first step. That'll happen in July. Once the board passes that resolution, it'll go to county commissioners, for they are the taxing authority for the health department, and they will approve the resolution to proceed as part of their processes. After we pass the resolution of necessity, the auditor will certify the rate and the amount. It'll go to the county commissioners and they'll pass the resolution to proceed. And then it'll be ready to be certified and be on the ballot in November. So that is the steps that we go through in order to get on the ballot, at least currently. And then that brings us to this legislative slide. So I've talked or hinted at a lot of changes could be happening, and there's been a lot of discussions out there that is all really relevant to property tax and what's going on. So this has been in the FYI report. Melissa does a really nice job of putting legislative updates in there. So if you've been reading that, some of these aren't new, but some of them drop, it almost seems weekly at this point. So House Bill 28 is the one that's been out there for a little bit now that talks about eliminating the ability to run a replacement levy. So that would not give you the ability anymore to basically reset your effective rate to keep up with inflation. It would make it harder to increase your amount of money because you can't just run a replacement. You'd have to run a renewal with additional, and it can get a little bit more complicated. So I have a couple of slides that shows you the difference between a renewal and replacement and why a replacement makes sense and is easier. But right now there is legislation out there in which they're trying to eliminate the ability to put a replacement levy on there. House Bill 137, I believe we talked about this one last board meeting as well. The language in there about giving the taxing authority the ability to pick and choose what levies they would put on the ballot, and it becomes more discretionary for them instead of just putting it on there, which is also could be scary for us.
Is that the one that changes from shall to may?
Yes. Yep. And then if you haven't heard about this, there is the push out there for the constitutional amendment by this group, Citizens for Property Tax Reform, that is out to eliminate property tax in the state of Ohio. So they got the Attorney General approval to proceed. So they are in the signature phase. They have to collect over 400,000 signatures by July 1st. From at least half of Ohio's voting counties. And if they do that, they would be on the ballot in November. So the possibility that property tax could get eliminated could be voted on in November, which obviously our levy is property tax. So that has major implications as well. And then, like I said, it almost seems to be dropping weekly now. Last Tuesday, House Bill 309 was dropped. And that is a bill to limit the amount of money that we can carry over in any fund from one year to the next, basically reducing our ability to plan for emergencies, build up any kind of contingency funds or anything for capital improvements and stuff like that. It limits our ability to carry forward money to 30% of whatever our estimated expenditures are for that fund for that year. Any money that you have in excess of 30%, they will reduce your tax collections in the subsequent taxing year, is the language. So they will reduce your levy collections in the subsequent year. That was just dropped last Tuesday.
And that's 30% of what?
Whatever your estimated expenditures are for that fund, and that applies to every fund. So there's no real way to play a shell game with that, or move it around, because it's regardless of the fund, it's every fund. So effectively you could only carry over 30% of whatever your operating budget was. So as you know, right now we do 25% in our special revenue funds and we do 100% in our general fund, and that's worked out really well for us. If we, to put that kind of in perspective, if we wouldn't have that policy, we wouldn't have been able to pay off the building early. That also resulted in saving $2 million of taxpayer dollars over the term of the loan of the building. So we would not be in a position to do that anymore. So that language was just dropped last Tuesday.
And where is that in the pipeline?
I think it is in Ways and Means in the House. And yeah, like I said, that was last Tuesday, and we had an all-member call on Friday, health commissioners, where it was discussed. And there's a work group working on that with the person that introduced the bill. So hopefully we can make some movement and headway there.
Do you know who introduced?
I don't have it written. I don't have it written down. In your FYI report, I believe Melissa has it in there.
Okay.
I'm not sure. I think she has the person who introduced the bill in there as well. So yeah, so there is a lot out there and a lot going on, and none of it's really good for us, to put it simply and straightforward. But we are on the ballot this year, and hopefully some of this, or most of it, or all of it, doesn't go through and doesn't end up impacting us in that way. If it does, obviously it has major implications on our ability to offer services in Greene County due to the fact of how much we rely on the levy for services. So to put a little bit of this kind of in graphical presentation to show you how this works over time, if you're not familiar with effective rates and the differences between the levy and why the replacement issue is so big, is because over time, when you run a renewal, you have something called an effective rate. So originally you run your levy we'll use us, for example, this example uses 2 mils. We can use 0.8, but for this we'll use 2. Your original levy that you get passed, its first year, it runs at 2 mils. It does not run at 2 mils for the whole term of the levy, because you are passing at a set dollar amount and property value increases year over year. You do not get access to the increase in property value. You are stuck at what you get passed. So that $2 million that is generated in the first year, you have to generate that same $2 million in subsequent years. So effectively you reduce and reduce and reduce the rate at which you are taxing. So that is how a effective rate works. So when you run a renewal, which is what we've been running, you do not get to reset in that taxing year for the next 5. You do not get to reset with whatever the current market value is of the property and community. So you don't get to get access to that increase in value as property values increased. You are stuck at that dollar amount. So you are still stuck at the $2 million, but you can see that we are now down to a 1.5 effective rate when we started at a 2. So kind of the problem with renewals is the fact that you just keep reducing and reducing and reducing your effective rate, and you are not getting reset to inflation and getting the dollars from the increase in pricing. So when you run a replacement, and this is where kind of the pushback comes and the argument for replacements, when you run a replacement, you get to reset your value to whatever the current appraised value is. So you generate more money. So this example is, It's not a new mill. You are not charging additional mills. You are just getting access to the fact that inflation has occurred. Property values have increased. And I think that's where people get confused. They think that you're charging more, or you're not charging more. You're just not charging what you were charging 10 years ago.
But they're paying more.
They're paying more because their house is worth more.
Correct.
But the millage rate is the same. So it's the same tax value. It's just your house is worth more now. So you're paying the equitable amount that you would have paid because it's still the 2 mills.
I mean, to me, that's crazy because it's so hard to explain to people
It is.
because it's costing me more, no matter what, you know.
It's costing you more because your house is worth
Right.
more. But yes, so what that looks like now, then, if you were to run a replacement levy at the same millage rate, you could see it generates $700,000 more. So it is not an additional millage. It is just you are now getting access to the fact that property value in your community has increased over time. So if you put it like this is what happens a renewal versus a replacement. And you can see the thick blue line is that reset of the replacement millage dollars. So you are bringing in that additional money as your community's worth from a property dollar standpoint increases and allows you to get access to those dollars to then put back into services. So that is a replacement versus a renewal. Right now, we've continued to run renewals. And replacements may no longer be an issue or may no longer be an option for many public service entities that do run replacements based on what happens with the legislation. So that's really it in a nutshell. But if you have any questions, I will gladly answer them.
How do new subdivisions impact?
So we do get access to new builds. That's the only additional money that we get. We don't get appraised value access, but as new subdivisions go in, we do get access to new build dollars. Usually what it equates to is our levy amount goes up about 1% a year is usually what happens, and that's due to new construction. So that's why you can say that we're usually relatively flat funded, because if your levy is 50% of your revenue and it only goes up 1% each year, you're pretty much bringing in about the same amount.
So in July, are you going to be asking the board to put forth a renewal levy?
Right now, we are looking at running a renewal to get to 2030. Financially, we feel like we're in a position where a renewal makes sense, and hopefully we can see how a lot of this plays out legislatively. So. Keep that presentation. Any other questions?
Thank you.
Welcome.
Hey, we have another guest come in. Do you want to let us know who you are and why you're here?
My name is Liz. I'm part of the UC program,
Okay.
so we're assets.
Well, welcome. And
Thank you.
if you have any questions after, please feel free to.
Appreciate it.
Thank you. Okay, we'll move on to the financial reports. Noah.
Been a long time since I talked. All right. Turning our attention to more financial information. For the income and expenditure report, we are reviewing information for May. So we are 42% through the year, almost 50% already. So for revenue, we're going to use that 42% target loosely because of how we bring in money more seasonally, but we'll use it loosely as a target. So that's that far right column. We would want to be at 42% collected or above for all of our funds for this point in the year to be on track. But really, we're going to look more closely at the ones we rely on for the most revenue. So the general fund, of course, that one is at 65% collected. So that's good. And then as we look to 0037, which is our next largest one, that one is at 52% collected. So those are both well above the 42% that we would want to see for this point in the year. And overall, we are at 62% collected of what we've estimated in total revenue. So that's pretty healthy for collections. The only ones that are a little off of that 42% are the funds that are grants. And those are very up and down with reimbursements, and we are getting to the end of a fiscal year, state fiscal year. So they will hold on to payments for 60 days. So reimbursement will come in slower for some of those as well. So other than that, it looks pretty good being at 62%. Moving on to expenses down at the bottom, that 42% makes a little bit more sense since the majority of our expenses are personnel. We could have a little bit more of a regular reoccurring month to month expenditure. So we want to be at 42% expended or less for those funds. So if we were to look at the general fund, it's right at 46%. So it's a little above, but it's not hateful. The 037, the clinical services fund, is right at 46%. That's also where the mobile clinic came out of. So remember, we paid for that already, and that was over $200,000. But overall for the year, we're at 43%. So we're right on target with where we want to be, even with some of those non-expected expenditures being relatively large. And in the general fund, we've already upgraded our IT servers and environment for this year. And that was a large expenditure as well. So we're right on track with where we want to be. Over to the bottom right corner, the financial indicators. If you want to look just at that operating ratio column, that's that one that basically tells you how efficient these funds are operating. So we want to be at 100% or less. That means for every dollar we've brought in, $1 has gone out. That would be 100%. So anything over that means we're spending more than we're bringing in. There's a handful of them that are like that. And again, they're mostly the grants. That's because you got to spend the money, then you get reimbursed for the money. And timing on those isn't always as expedient as we would like. So overall, though, the general fund is right at 50%, which is great. And we're at 78% as an agency. So we are under that 100% that we would want to see. So we are bringing in right now more than we are spending. Any questions on the income expenditure report? Cool. Next report is the voucher summary. So those are your expenditures for the month. So that's on your goldenrod paper. Give you a handful of minutes to look through that. And if you have any questions over any of the expenditures, I will gladly answer them. Mine does look right. Here you go. Fine.
I had a question earlier. I was looking at these at home. And I can't find it now. But it was, I think, $10,000 to Greene County Sheriff.
Oh,
Just
you
what-
weren't at the meeting last month. That was, the Greene County Sheriff reached out to us as part of, was purchasing equipment for one of the programs.
Right.
And that was a Board of Health approved expenditure. We were using One Ohio recovery money. Any questions over the voucher summary? Moving on. The last report is the appropriation transfer. So this is just the movement of money within a fund from either the cash balance into a line item or one line item into another. It's basically just to pay bills. So it's on your salmon colored piece of paper, and you can just see the movement of money recorded for the month. There's nothing super outstanding in there. Any questions over any of the appropriation transfers? I got.
Well, I need a motion and a second to approve the monthly income and expenditure report, the voucher summary and the appropriations transfers.
Second.
All in favor, say aye.
Yeah.
Opposed? Motion carried. Okay, we'll move on to reports. Governance committee, Nancy,
No, no report.
performance evaluation, Bill. Planning and finance, I don't think Andy's here, but we didn't have a meeting. Okay, move into new business. We have, a private water variance request from Luke and Sean Human for 1399 Stone Ridge Court in Xenia. I guess it's an addendum to it. So I'm not sure. Is Shadrick gonna talk? Shadrick, you wanna talk?
Yeah. Thank you all. Can you hear me?
Yes.
Yeah.
Oh, okay, thank you. Yeah, so we had an interesting situation here on this newer home. Initially a well was drilled there very deep without finding any water veins. Then the well was sealed improperly by one contractor, Boone Water Systems. After the well was sealed, another well was drilled and water was found much shallower. But we couldn't approve the water system as a whole because the initial water, the initial well, which was not water bearing, ended up being sealed improperly. So this resulted in a bond claim through the Ohio Department of Health, which meant that Boone Water Systems bond would be attached to make a repair to that sealing so that it was sealed according to what the law says it should have been. Now, the problem with that is that because of the nature of the well's construction, no well contractor really wanted to do it the traditional way of repairing a poorly sealed well. What we came up with was what I think you see in the variance there, which is a much more modest excavation and a sealed or a welded top to this well casing several feet below the ground so that we could be sure that that old well drilling didn't become a funnel for pollution and contaminate the aquifer. So that's what's being proposed. Now, in order to get this approved, according to the Ohio Department of Health, we needed to put this proposal in writing, which I think you have there, and then have the board sign off on this somewhat unusual circumstance so that the repair that's being proposed could be made and the Human family could go ahead and get this thing signed off and we can approve their water system as a whole. So that's what we're looking at.
Any questions for Shadrick?
Do we know why the original contractor refused to fix it?
Yeah, I do. He's a very difficult person. He's been rather abusive to my staff. We don't have to go into that right now. It was pointed out that he used a sealing slurry that is pumped down the hole of the well that didn't meet the correct density requirements. And it wasn't a technicality. He was off by quite a bit, several percentage points. When that was pointed out to him, he bluntly refused to do anything to make a correction. His defense was that the equipment he used demanded this sort of density, whereas the regulation plainly says it must be this dense. So the Ohio Department of Health, it was put to them because ultimately it's their rules, and they sided with us. Yeah, he needs to fix that, or his bond could be claimed. And he held fast. He was not going to attack. He wasn't going to try to do anything to make it right. And so ODH allowed the bond claim to go forward.
Okay, thanks.
Sure.
What would happen if we did not approve the variance?
That home would never have an improved water system.
The home?
That's
Is that what you
correct.
said? Oh,
Yeah, the home.
okay.
The rules
Is it a
say
new home?
it is a rather expensive one on Stone Ridge Drive, I think. The home was about, I think, 1.4 million. Lots of questionable things. The dry hole was nearly 300 feet deep. The well that was properly dug was, I think, barely 100. So you can see the disparity here between the quality of workmanship between the contractor who was to blame in this case and any other average well driller. So we've got that going on too. Our just a little more background here. Our initial instruction was, hey, you need to pull all that old bentonite, all that old sealing material out of there and seal it with the correct density. A little background here. We use something called bentonite hole plug. It's literally 3/8 in diameter. It's kind of like chunky cat litter. A lot of early cat litter, not the paper stuff that we use now, the clumping stuff, but a lot of early cat litter was literally bentonite clay. What happens is that upon the introduction of water, that bentonite will swell up and properly hold a seal. What can happen, though, if the density isn't correct, is that it can swell up, then dry out and crack. And so essentially what you have is a funnel for contamination from the surface to go 300 feet down into the water and pose a liability for the whole aquifer in the neighborhood. So that's why it's so important that it be done correctly. We've made multiple attempts over many months to have this corrected. And like I said, it was just an outright refusal. As you can see on the variance, my team supports this. This is the best scenario we have for this situation. The whole thing is unfortunate. I feel quite sorry for the homeowners because they're the ones that are left to deal with this thing. But I believe a variance is in the best interest of everyone in this case.
The homeowner's able to sue the contractor?
There was some discussion about that. But first, what would happen is that the bond claim would be made, which is what's being done here to repair it first. That's the provision per the regulation for private water, is that a bond claim is made to make right what is wrong. So,
But is the solution that's being proposed is that's the correct way to address the problem?
it's an acceptable secondary way. The correct way would be literally, as I mentioned, to drill it all out, but no contractor in either Ohio or Indiana will touch that because it poses a risk to their equipment, essentially. Because this went on for months and months to try to get them to do that, my team, that is, proposed this secondary idea, which made it to the Ohio Department of Health, who signed off on it as being acceptable if the Board of Health would agree for a variance.
Any other questions? Okay, so we're voting on the private water variance request for this property, right?
Yes, ma'am.
So I need a motion and a second to,
I motion to approve the variance.
Second.
all in favor, say aye.
Aye.
Opposed?
Thank
Okay,
you all.
motion carries.
Pardon me. Thank you all. The human family be delighted. I appreciate it.
Okay. Next on the new business is introduction of the data analyst position within the planning, promotion, and preparedness department. Who is?
That'd be me. Me again. Yeah, so anytime that we create a new position at the health department or consider creating a new position, it comes to the Board of Health for discussion and approval. So tonight we are not seeking an action. Tonight is just informational only. So you should have the job description in your packet and have the ability to look at that between now and the next meeting. But I wanted to introduce the position. So we are wanting to establish a data analyst position. inside of our planning, preparedness and promotion team. What this position will essentially do, will work closely with other programs on all of their data collection and data support work and what they need for their grants and various programs, and help provide them with those data and statistical analyses. Additionally, it'll heavily focus on implementing the strategies and doing the data research for the community health assessment, which we're going to conduct again in this upcoming year, because we're on a new CHA and CHIP and strategic plan cycle in 2026. So they will be doing that work in-house this year, doing the assessments and doing a lot of the strategy research. So yeah, so this position would be primarily focusing on providing that data support and be under the supervision of Cheryl. So it's for information tonight, not seeking any action. Feel free to read through it and then ask any questions or come with questions next month. And in July, we would be asking for you to make an action on it to approve this establishment of it.
Now, who's done this data info for the child and chip in the past?
So it's usually, right now we have 2 accreditation coordinators. And the reason that we have 2 accreditation coordinators is because one of them has kind of been more geared towards the data side of this, and one's been more geared toward kind of the creation of the plans and, you know, adhering to the standards and stuff like that. Not doing this position to its fullest, but definitely more geared towards the data and chip and CHA side. And under this, if we were to get the approval of this, we would not carry 2 accreditation coordinators anymore. We would go down to 1 accreditation coordinator and 1 data analyst. So the work would continue to get done, and then in greater detail in a little bit more specified scope, which is why this position made sense, because we could expand more in there, especially since the assessment and surveillance competency within the FPHS framework is an area that we feel like we need to continue to build capacity in. This is one of those avenues to allow us to continue to build capacity there in our workforce.
And would one of the accreditation people lose their position?
They would not. The idea would be to transition one into this role.
And what's the average salary range for this?
It's a C43, so it's in the same band as the current accreditation coordinator role.
What's a C43 level pay range?
Off the top of my head, it's probably somewhere between 50 and above entry level, somewhere like that. I couldn't tell you what the end range is, to be honest, but it's somewhere in that neighborhood.
Any other questions? Well, we will look at that again next month then. Moving on to additional business. There's an employee summer getaway that will take place at Caesars Ford Park in the Blue Jacket Room and Pavilion on Thursday, July the 10th at 11:30, and we're all welcome to attend. And then another reminder that our July meeting will take place on July 10th instead of July 3rd because of the holiday. So
Be in person.
Yes, a reminder that we'll need to be in person for the virtual meeting policy because of voting on a tax issue. So please don't.
Yeah, have that often.
Any other new business somebody wants or no? Dr. Sheriff, do you wanna say?
I guess good news, we've been talking about the measles for several months now, and earlier today, some of you may be aware, Dr. Vanderhoff, the director for the Ohio Department of Health, had a press conference and said that the measles outbreak in Ohio is officially closed. There's not been a new case since April. There were 34 cases in the state of Ohio. And said adequate time has passed, that the outbreak is officially closed in the state of Ohio. Still spreading nationwide. I think about 25, 26 states have had measles outbreaks and still having measles outbreaks. I think the highest year for measles in recent history was 2019, which is 1,200 cases. And we are now in the early days of June, and we've had 1,100 cases so far in this year. So no doubt will be a record-setting year for measles. And but locally, anyway, the state of Ohio specifically is closed. Every silver lining has a cloud, though, and he raised the awareness for whooping cough. And so whooping cough cases are on the rise. And I think the highest year for whooping cough recently was 2010, and about 1,200 cases of whooping cough. And so far this year, we've had almost 600 cases. So the concern now is about whooping cough to at least be aware of. So that's the latest information I have in terms of what's going on infectious disease wise.
Thank you. Melissa, do you have anything you'd like to bring up?
I do, just very briefly, just to make you all aware of the impact that this data breach or hacking that has occurred with Kettering and how it's just affected the health department. So I've mentioned this before, but many, many years ago, a long time ago, when I started in public health, we would receive disease reports through the mail most often. And so things like measles, any vaccine preventable disease, you know, we might get the report a few months to, I don't know, 4 or 5 months, 6 months late. And it makes it very difficult to get ahead of any of these outbreaks. And so their situation over there is that then now disease reports that normally came to us, and this would include any of those infectious diseases, communicable diseases, TB, sexually transmitted infections, were not being transmitted to us anymore because really everything was down. We did reach out, to Incident Command over there and let them know that we were waiting on that, rabies reports, birth and death that would have been reported, especially from soy, because that's where a lot of Greene County reports come from, is through that hospital system. And so it looks like things will be back on shortly, but it certainly reminds all of us of the importance of, protecting this data, especially our patient and client data, and that any one of us could be vulnerable. So in the past few months, what we've been working on are things like our own cybersecurity plan for the health department, and then what our response will be should any system or computer get tapped, as well as the new challenge of AI in healthcare. And so I just wanted to make you aware that there was an impact. We are working on our own plans in response to any of incidents like that happen. So that's all I have.
Anybody else have anything? Nancy, do you have anything?
Nope.
No. Okay, nothing else, then we'll adjourn.
Make sure I'm not. Recording.